China has a large population, and there is the voice claiming that the novel coronavirus will mutate again in this large-scale spreading process in China.
SARS coronavirus 2 will continue to mutate in China and elsewhere in the world. All right, it's not like the other parts of the world do not have SARS coronavirus 2 now.
Can we make the prognosis that the variant's getting less deadly during its mutation period? And if not, how should we get prepared for that?
Now, while it is impossible to be 100% accurate in predicting how the virus mutates, if you look at the history of other human coronaviruses, there are a few that are considered to be mild flu-like seasonal coronaviruses: human coronavirus OC43-229E, NL623, and HKU1. Now, these coronaviruses have all probably caused a major outbreak without us knowing years and decades ago. And they subsequently became gradually adapted among humans to become almost like a seasonal respiratory virus. So this is what we hope and predict would be the more likely chance. Now, having said that, you are very correct. We should remain vigilant about emerging variants with the following measures. Number one, continuous surveillance of SARS-CoV-2 variants to detect new genomic mutations that may change the behavior of the virus. Number two, systemically study them in representative in vitro and animal models to understand their replication, pathogenicity, and transmissibility, as you have asked before. Third, gather real-life clinical and epidemiological data of how severe and how transmissible these new variants are. And finally, the most important is we must use this time before the next Omicron or SARS-CoV-2 emerge to develop broad-spectrum antiviral treatments and vaccines that are not just effective against one variant or one coronavirus, but that is effective against all coronaviruses.
Another question is, what do we know about the post-COVID conditions, especially about the Omicron variant?
Sure. Many of us have heard about long COVID. So long COVID has been used to describe a condition where some of our patients who have recovered from the acute phase of COVID-19 develop persistent symptoms such as feverishness, tiredness, shortness of breath, and sometimes neurological symptoms and so on for months. Now, in animal models, we also observed that SARS-CoV-2 can induce inflammation in other organs, for example, the male genital tract and the musculoskeletal system. Now, we and others are also now studying the differences in long COVID manifestations between those who were infected with previous strains, which are more virulent, and with Omicron. Sufficient to say that at present, we know very well that with vaccination, there is emerging data showing that vaccination can indeed help to reduce the risk and severity of long COVID-19. So I think, after all, we do not know everything about long COVID yet. How we treat it, how long it will last, what are the complete pictures of the clinical manifestations. But I think vaccination is going to be the key here to help reduce such long COVID symptoms.
I see.